If you are over the age of 70 and your doctor recently gave you a gold star because your blood pressure hit that textbook perfect reading of 120 over 80, you need to stop what you're doing and pay close attention. We have been conditioned for nearly half a century to believe that lower is always better. From every medical journal to every evening news health segment, the message has been drummed into our collective consciousness. Blood pressure is a silent killer, and the only way to stay safe is through aggressive suppression. But for the senior population, this conventional wisdom isn't just outdated, it is being flipped on its head by modern science. A groundbreaking study recently published in the Journal of the American Medical Association, or JAMA, tracked 15,000 seniors over the course of 5 years. What they found didn't just ruffle feathers in the medical community, it sent shockwaves through it. The research revealed that seniors who maintained what doctors call perfect blood pressure faced a 28% higher risk of serious, life-altering falls. More alarmingly, their overall mortality rates, their risk of dying from any cause, were significantly worse than those of their peers who maintained moderately higher numbers. We are witnessing a quiet epidemic of overmedication, where the pursuit of a perfect number is inadvertently leading to fractured hips, emergency room visits, cognitive decline, and a permanent loss of independence. I'm Dr. Alexander Snow, and my mission is to bridge the gap between high-level medical research and your daily survival. Before we go any further, I need to know who I am speaking to. The advice I'm about to share applies very differently to a 66-year-old than it does to an 86-year-old. Right now, go to the comments and type your age, just your age. And if you have ever felt a split second of dizziness when you stand up from your favorite chair or get out of bed in the middle of the night, add the word dizzy next to your age. This is the most critical diagnostic data point I can see from this side of the screen, and by the end of this video, you will understand exactly why that head rush is a more important health indicator than any number on a blood pressure cuff. Let's look at what is happening in thousands of clinics every single day. Imagine a 78-year-old woman named Margaret. She's active, she gardens, and she's mentally sharp. During her annual checkup, her blood pressure reads 145 over 86. Her doctor, a well-meaning professional, looks at the standard clinical guidelines on his screen. Those guidelines say that anyone, regardless of age, should ideally be under 130 systolic. The doctor sees a problem that needs fixing. He reaches for the prescription pad and adds a second antihypertensive medication to her daily routine. 3 months later, Margaret returns. Her reading is 122 over 76. The doctor is thrilled. He tells her she's doing great and that she's protected. But Margaret doesn't feel protected. She feels tired. She feels a little foggy in the mornings. And most importantly, when she stands up to answer the phone, the world tilts for a second. The doctor dismisses this as just getting older. But what the doctor isn't seeing is that Margaret's cardiovascular system is no longer capable of maintaining that 122 pressure when she's vertical. While her blood pressure looks perfect while she's sitting still in a padded office chair, it is cratering to dangerous levels the moment she stands up. This isn't a success story, it's a setup for a tragedy. To understand why the 120/80 target is dangerous for seniors, we have to talk about how your body changes after 70. You are not just a wrinkly version of your 40-year-old self. Your internal plumbing has undergone a fundamental biological transformation. For someone in their 40s or 50s, aggressive blood pressure control is vital. It prevents the long-term wear and tear on the kidneys and the heart that leads to disease 20 years down the line. But once you reach 75, the math of survival changes. The first major change is arterial stiffness, also known as arteriosclerosis. Think of a brand new garden hose. It's flexible, it expands when you turn the water on, and it absorbs the pressure. Now think of a hose that's been sitting in the sun for 25 years. It's stiff, it's brittle, and it doesn't expand. Your arteries do the same thing. As they stiffen with age, your heart must pump with more force to ensure that blood actually reaches the furthest reaches of your body, specifically your brain. Consider the physics of gravity. Your brain sits roughly 1.5 feet above your heart. Every second of your life, your heart is fighting an uphill battle to push oxygenated blood against the pull of gravity. In a young, elastic cardiovascular system, this is easy, but in a 75-year-old system with stiffened vessels, the heart requires a higher head pressure to win that fight. If you use powerful medication to drop that pressure to 115, you may be protecting the pipes, but you are starving the engine. This is why many seniors feel a sense of persistent fatigue or brain fog that they mistakenly attribute to old age. The second change is the decline of your baroreceptors. These are microscopic pressure sensors located in your carotid arteries and your heart. Their job is to act like a high-speed thermostat. When you stand up, gravity naturally pulls blood toward your feet. In a 30-year-old, the baroreceptors sense this drop in milliseconds. They signal the brain, the heart speeds up, the blood vessels constrict, and the pressure stabilizes. As we age, these sensors become sluggish. They don't react with the same snap. If your baseline blood pressure is already being pushed down into the 110s or 120s by medication, and your baroreceptors are slow to react, your pressure will drop into the 80s or 90s the moment you stand up. This is called orthostatic hypotension, and it is the single most common cause of unexplained falls in the elderly. A fractured hip at age 80 is not just an injury. For many, it is the beginning of a rapid decline in health that leads to the end of life. This is why perfect numbers can be so deadly. Most patients assume that medical guidelines are based on people exactly like them. But here is a dirty secret of medical research. For decades, most major blood pressure trials excluded the very old or the frail. They studied 50-year-olds and then extrapolated those results to 80-year-olds. It wasn't until very recently that researchers began looking exclusively at the over 75 population. The JAMA internal medicine study I mentioned earlier followed over 15,000 seniors with real-world problems: diabetes, history of mild strokes, or kidney issues. They divided these seniors into groups based on their average systolic top number. The results were a bell curve of mortality. The group with the lowest mortality and the highest cognitive function wasn't the 120 group. It was the group between 130 and 140. The study found that for every point you drop below 120, the risk of adverse events climbs. Specifically, the group with blood pressure below 120 experienced significantly higher rates of acute kidney injury. Your kidneys are pressure-dependent organs. They need a certain amount of push or head pressure to filter toxins out of your blood. If you drive the pressure too low with medication, the kidneys begin to struggle, leading to a cascade of metabolic issues that doctors often misdiagnose as just aging. Furthermore, the risk of syncope, the medical term for fainting, was highest in the perfect group. Think about the irony. We are giving seniors medication to prevent a stroke 10 years in the future, but that very medication is causing them to pass out and hit their head on a granite countertop today. We are trading a theoretical future risk for a very real, immediate physical danger. There is also the critical issue of vascular dementia and overall cognitive decline. While high blood pressure is a known risk factor for dementia, we are now learning that excessively low blood pressure in the elderly can be just as damaging. Your brain is the most metabolically active organ in your body. It requires a constant, pressurized stream of glucose and oxygen. When you over-medicate an 80-year-old to reach a 115 systolic reading, you are essentially underperfusing the brain. This can lead to brain fog, memory gaps, and a faster progression of cognitive decline. I have seen countless patients who were labeled with early Alzheimer's suddenly wake up and regain their mental clarity once their blood pressure medication was slightly reduced and their pressure was allowed to rise to a safer 135 or 140. When you starve the neurons of pressure, you starve the mind of its ability to process information. We must also discuss pharmacokinetics, the way your body processes drugs. When a doctor prescribes a standard dose of a blood pressure medication, that dose was likely tested on middle-age metabolisms. However, by the time you reach 75, your liver and kidneys do not clear these chemicals with the same efficiency. This means a dose that is perfect for a 50-year-old can become excessive or even toxic for an older adult. The drug lingers in your system, building up to a higher concentration than intended. This is why many seniors experience crashes in their blood pressure in the late afternoon or middle of the night. Their bodies simply cannot get rid of the medication fast enough. This is why the one-size-fits-all approach to blood pressure targets is not just lazy medicine, it's dangerous medicine. If this research is so clear, why hasn't your doctor told you? The answer lies in the slow-moving gears of medical bureaucracy. It typically takes 17 years for a new piece of clinical research to become standard bedside practice. Doctors are trained to follow guidelines, and those guidelines are updated only once every few years. Furthermore, many physicians are terrified of deprescribing. They worry that if they reduce a patient's medication and that patient later has a stroke, they will be held liable. So they stick to the aggressive targets, even when the patient in front of them is showing clear signs of being overmedicated. Consider the psychological impact of being told you are ill because your pressure is 142. For decades, the medical establishment has used fear to drive compliance. We tell seniors that if they don't hit the 120 mark, they are a ticking time bomb. This creates a state of chronic stress, which ironically raises blood pressure further, leading to a vicious cycle of overtreatment. We need to move away from fear-based medicine and toward function-based medicine. Now that we understand the biological shift and the sweet spot, we have to address the how. How are we lowering this pressure, and what are those specific chemicals doing to an aging body? Most patients are on a cocktail of medications, a diuretic for water retention, a beta blocker for heart rate, and perhaps an ACE inhibitor for vessel dilation. While these are wonder drugs for a 50-year-old, in the senior population, they can create a pharmacological fog that is often misdiagnosed as dementia or general frailty. I want to take a moment to break down the 3 most common classes of blood pressure medications and explain exactly how they interact with an older nervous system. First, let's talk about diuretics, often called water pills. These work by telling your kidneys to dump sodium and water into your urine. This reduces the total volume of fluid in your pipes, which naturally lowers the pressure. However, in a person over 75, diuretics can be a double-edged sword. As we age, our thirst mechanism becomes less sensitive. Seniors are already prone to subclinical dehydration. When you add a powerful diuretic to that mix, you aren't just lowering blood pressure, you are depleting essential electrolytes like potassium and magnesium. Low potassium leads to muscle weakness and heart palpitations, but low sodium, a condition called hyponatremia, leads to confusion and unsteady gait. I have seen hundreds of patients who were brought into the ER for a stroke evaluation, only to find out they were simply over-diuresed and their brain was short-circuiting due to low salt. Next are beta blockers. These medications work by blocking the effects of adrenaline on your heart. They slow the heart rate and reduce the force of the contraction. In a younger patient with high stress and a racing heart, this is a miracle. But remember what we said about the baroreceptors? When you stand up, your heart needs to beat faster to push blood to your brain. If you are on a high dose of a beta blocker, your heart is essentially capped by the medication. It wants to speed up to keep you from fainting, but the drug won't let it. This results in that sudden blackout feeling when you stand too quickly. Furthermore, beta blockers are notorious for causing vivid dreams and fatigue in seniors, which can drastically reduce their quality of life. If you find yourself unable to walk up a flight of stairs not because you're out of breath, but because your heart simply won't kick into gear, your beta blocker dosage may be the culprit. Finally, we have calcium channel blockers, like amlodipine. These work by relaxing the muscles in the walls of your arteries. While they are very effective at lowering that top systolic number, they frequently cause significant swelling in the ankles and legs, what we call peripheral edema. For a senior, heavy, swollen legs are more than just a cosmetic issue. They make it harder to walk, increase the risk of skin infections, and contribute to a sedentary lifestyle. If you are taking a pill to lower your pressure, but that pill makes you too tired or too swollen to go for your daily walk, is that medication actually helping you live longer? The answer, according to the latest longevity research, is a resounding no. We must prioritize the immediate safety of the individual over a statistical average. Medicine is not an exact science. It is an art of balancing risk. For a 40-year-old, the risk is a stroke in 30 years. For an 80-year-old, the risk is a broken hip tonight. The most difficult conversation in modern medicine is the one about deprescribing. Our current medical system is designed to add, not subtract. If you have a problem, you get a pill. If that pill has a side effect, you get another pill to treat the side effect. By the time many of my patients reach 80, they are taking 12 different medications. This is called polypharmacy, and it is one of the leading causes of hospitalization in the elderly. Deprescribing is the intentional and supervised process of reducing or stopping medications that may no longer be providing benefit or may be causing harm. It requires a doctor who treats the patient, not just the numbers on the screen. Let me tell you about a patient of mine, a 79-year-old retired engineer named Robert. Robert was a numbers guy. He kept a spreadsheet of his blood pressure, and he was obsessed with keeping it under 120. He was taking 3 different medications to achieve that goal. However, Robert had stopped playing golf because he felt unsteady. He had stopped driving at night because he felt foggy. When he came to see me, his pressure was 118/74. On paper, he was a perfect patient. But when I performed the gravity test, his standing pressure dropped to 92/60. Robert wasn't suffering from old age. He was suffering from medical success. We spent the next 6 months slowly tapering off one of his medications. We watched his numbers climb. When his pressure reached 138/82, Robert was terrified. He thought he was going to have a stroke that afternoon. But a funny thing happened. His brain fog lifted. His energy returned. He went back to the golf course. Most importantly, his standing pressure stabilized at 130. By allowing his pressure to rise to a moderate level, we actually reduced his risk of death from a fall and improved his cognitive function. If you are ready to have this conversation with your doctor, you need a plan. You cannot just stop these medications cold turkey. That can cause rebound hypertension, which is genuinely dangerous. Instead, you must ask for a trial reduction. Ask your doctor, what would happen if we reduced this dose by half for 1 month and I tracked my numbers and my symptoms? This trial approach is much less scary for doctors than a total stop order. It allows for a safety net. You are looking for the minimal effective dose, the smallest amount of medication needed to keep you in that 130 to 145 sweet spot while maintaining your ability to stand, walk, and think clearly. You are the employer, and the doctor is the consultant. You have the right to ask for individualized care. When you visit your doctor, don't just say, "I want my pressure higher." Say this, "Doctor, I've been reading the recent JAMA studies regarding blood pressure targets for people over 75. I'm concerned that my target of 120 is putting me at risk for falls and kidney stress. Can we look at my orthostatic readings and discuss a target closer to 135 or 140 to prioritize my quality of life and fall prevention?" A good doctor will welcome this conversation. If your doctor refuses to even look at the research or listen to your concerns about dizziness, it might be time to find a geriatric specialist, a doctor who specifically understands the unique biology of aging. You are not a chart. You are a human being with a unique history and physiology. You don't need to wait for your next doctor's appointment to find out if you are at risk. You can, and should, perform what I call the gravity test tonight. This is formally known as checking for orthostatic vitals, and it is the most important test a senior can take to predict their risk of a life-changing fall. To do this, you need a reliable home blood pressure monitor. First, lie down flat on your bed or your couch for 5 minutes of total rest. Take your pressure while lying down and write those numbers down. Next, stand up. Don't do it slowly. Stand up at a normal, brisk pace. Immediately, within 30 seconds of standing, take your blood pressure again while you are still upright. Do not sit back down until the cuff has finished its reading. If your top number drops by 20 points or more, or your bottom number drops by 10 points or more, you have orthostatic hypotension. This means your sitting pressure is a lie. So what should your target actually be? I must emphasize that you should never change your medication without consulting your doctor, but you should go into that consultation armed with the latest data. For those aged 65 to 74 who are generally healthy, a range of 130 to 140 systolic is often the Goldilocks zone. For those aged 75 to 84, the evidence supports a range of 135 to 145, and for those 85 and older, or those who are frail, many geriatricians now accept and even prefer a systolic range of 140 to 150. You also need to watch your bottom number. If your diastolic pressure drops below 60, your heart muscle itself may not be getting enough blood flow during its rest phase. This is because the coronary arteries, which feed the heart, only fill when the heart is relaxed, between beats. If that diastolic pressure is too low, the heart can actually suffer from silent ischemia, a lack of oxygen that weakens the heart muscle over time. As we wrap up this deep dive, I want you to change your perspective on what healthy looks like in your 70s, 80s, and 90s. The medical industry often treats aging as a disease to be cured or a series of numbers to be managed. But aging is a triumph of survival. Your body has spent 7 or 8 decades adapting to the world. A slightly higher blood pressure is often your body's way of ensuring that its most precious organ, the brain, remains fueled and functional. When you prioritize a number on a cuff over your ability to play with your grandchildren, go for a walk, or remain mentally sharp, you are making a bad trade. You are trading your right now for a statistical maybe. My goal for you is not to have the blood pressure of a 20-year-old. It's to have the lifestyle and safety of a thriving senior. Your journey to safer health starts tonight. Buy a monitor if you don't have one. Log your data morning and night, and listen to what your body is telling you. Dizziness is not a symptom of age. It's a symptom of a problem. Brain fog is not always a senior moment. It can be a sign of low perfusion. You now have the knowledge to protect your independence and your longevity. If this video gave you the confidence to advocate for yourself, do me a favor and type the word informed in the comments. And if you know someone over 65 who is constantly struggling with lightheadedness or who is obsessed with hitting 120 over 80, please share this video with them. It could genuinely save their life. I'm Dr. Alexander Snow. Stay informed, stay upright, and I'll see you in the next video where we dive into the supplements that actually work for your heart and the ones that are a complete waste of your money.